are starting the session about oral health and diabetes. And this is my pleasure to introduce you Professor Buysschaert. Guys? So, my pleasure to introduce you Professor Buysschaert. I met him in Madrid earlier this year when we worked together with IDF and EFP on oral guidelines for diabetologists, doctors and patients. And Professor Buysschaert will speak to you about periodontal disease and diabetes. So, Professor.
Okay. Thank you, Mr. Chairman. First of all, dear friends, I would like to thank the organizing committee and the young leaders in diabetes for this kind invitation to attend this session. So, we all know that. We all know that diabetes through hyperglycemia is associated potentially with the development of vascular and neurological complications if glycemic control is poor. We know that. But besides these conventional lesions, diabetes contributes also to the development of other pathological conditions, in particular oral diseases. In particular oral diseases such as dry mouth syndrome, what is called xerostomia, oral candidiasis, which is a fungal infection, a burning mouth syndrome, which is due to neurosensory disorders, dental caries, and delayed healing of ulcers in the mouth. This was already reported by IDF in 2009. But since then, in addition, an association between diabetes and periodontal disease has also been suggested. So the aim of my presentation today is to propose you a state-of-the-art in the association concerning diabetes and periodontal disease. And I would like to subdivide my presentation in four main parts. 4 questions. Question 1. What is exactly periodontal disease? For you, for me. I am not a periodontologist. Second question. Is this relationship between diabetes and periodontal disease now, in 2017, is this relationship definitely validated? Question 3. Conversely, is there also an association between the inverse, periodontal disease and diabetes? And finally, my last question will be, what are, for you, for me, what is the future? What are the perspectives? So, I will start with the first question. What is exactly periodontal disease? Well, the bad boy, the guilty guy, is what we call the dental plaque. The dental plaque is a thin, colorless pellicle which originates from the saliva. The dental plaque is contaminated by a huge number of bacteria. When you brush your teeth, you remove the dental plaque. But if you don't do that, the dental plaque still remains, and complications, progressive complications, will develop. And the first complication is what we call gingivitis. Gingivitis is a state, an acute or a chronic inflammatory state of the gums. And this means red appearance gums, swollen gums, and bleeding gums. This is the inflammation of the gums. This is gingivitis. Gingivitis is reversible, totally reversible with oral health care. But again, if you don't treat gingivitis, gingivitis will progress to another condition which is called periodontal disease, periodontitis. What does happen? What does happen? To make a long story very short, I try to summarize. Well, the dental plaque and the substrate of the dental plaque, the bacteria, the tartar, will infiltrate in these recessions, in these physiological recessions between the teeth and the gums. And the dental plaque will there form pockets, deep pockets. And these deep pockets are really micro abscesses with a lot of consequences, with a lot of long-term consequences. A progressive damage of the tissues surrounding, supporting the periodontium, with as a consequence, a major consequence, a progressive destruction of bone, of the alveolar bone supporting the teeth, with as a consequence, a retraction, as you compare that, a retraction of the gums with more teeth motility and finally teeth loss. So this is a long story in summarized. So the take-home message for you: periodontitis is a common chronic inflammatory disease leading to a progressive destruction of tissues supporting the teeth. That's the main message for you, for me. Periodontal disease is very frequent, even without diabetes. In my own university in Belgium, 40% of employed persons had some degree of periodontitis. And more recently, in 2015, as you can see, 46% of an adult population in the United States, 46% of adults in the United States had some degree of periodontal disease, with 9% demonstrating severe lesions. So, you will agree that periodontal disease, as I discussed with the chairman just a few minutes ago, is a major health problem. It's a worldwide major health problem. Now, let us move to the second part of my talk, to the second question. Is this relationship between diabetes and periodontal disease definitely validated? The answer is yes. The first observation of such a relationship between diabetes and periodontal disease is an old one. The first observation was published in Pima Indians in Arizona, United States. Pima Indians are predisposed to diabetes for genetic and environmental reasons, type 2 diabetes. Well, the prevalence, the frequency of periodontitis in Pima Indians with diabetes, with type 2 diabetes, was 60%, more than 1 in 2. The prevalence of periodontitis in Pima Indians without diabetes was 36%. This means that the risk of periodontitis in the presence of diabetes is multiplied by a factor 2.6 even after adjustment for all confounding factors. And in 30 years ago, the authors of these studies concluded, yes, periodontal disease should be considered a non-specific complication of what was called non-insulin dependent diabetes mellitus. And not only the prevalence of periodontal disease is increased in patients with type 2 diabetes, but also the severity of periodontal disease. As you can see, the severity of periodontal disease in each age category is significantly more marked in the presence of diabetes than in Pima Indians without diabetes. And we have another indirect demonstration of that. We have other papers, more recent papers. The previous papers were quite historical papers. Now we have recent papers. In 2009, the risk of periodontal disease was 2.3 times higher for diabetics than for non-diabetics. And in 2012, in Diabetology, a famous newspaper of diabetes, susceptibility to periodontitis is increased by threefold in people with diabetes. And in view of the convergence of all these data, these people from India concluded in their editorial in 2014, diabetes and gum disease, the diabolic duo. And they considered that periodontal disease was the sixth potential complication of diabetes. Now, in type 1 diabetes, we have also some data, and the data are in the same direction, even if more moderate. In this paper, 1998, it's also an historical paper from the United States. As you can see, the severity of periodontal disease was also more marked in persons with type 1 diabetes than in a control group, at least after the age of 40 years. And so they also concluded a long time ago the possible impact of type 1 diabetes on oral health. And this is an important message, should be included in the overall management. Now, this is a difficult slide, but there is one important message. It's a study from Germany, the SHIP study. The message of the study is, yes, diabetes is associated with periodontal disease, but there is a main difference according to the glycemic control. All these parameters, all these measures of periodontal disease are less marked, are less present if glycated hemoglobin levels are excellent, if glycated hemoglobin levels are less than 7%. As you can see, the risk of all these complications is increased by 60% versus controls in the presence of poor glycemic control. In the presence of excellent glycemic control, look, the risk is exactly the same in persons with diabetes than in a control population. So that is a very important message. And this message is confirmed indirectly by these data. If you have complications, if you have a lot of complications, and this means probably poor chronic glycemic control, if you have a lot of these complications, the risk of periodontal disease is also multiplied by a factor 2 to 4. This confirms the role of poor glycemic control. So, your question now could be, well, what's the explanation of that? Why is diabetes associated with more frequent, more prevalent periodontal disease? Oh, there are a lot of explanations. But I try to summarize. In this slide. In fact, as you could anticipate, the initiating event is hyperglycemia. The final event is an unbalance between the enhanced tissue, periodontal tissue destruction, and impaired periodontal tissue repair. And this unbalance leads to periodontitis. And the reason for this unbalance is multiple. You have a lot of explanations for that, a lot of not always easy to understand explanations, such as an increase of adipokines, such as a dysfunction of the immune system. So that's question 2. So the answer to question 2 is diabetes associated with periodontal disease. Is this now validated? Clearly, yes. Now, question 3 is conversely, is periodontal disease associated with a future development of type 2 diabetes? Well, again, but before answering the question, just one more slide to tell you that, in fact, as you can see, diabetes, but also pre-diabetes, but also already obesity, they amplify conventional risk factors present for everybody, risk factors for periodontal disease, such as the genetics, such as smoking. Smoking is a main risk factor of periodontal disease, osteoporosis, deficiency in diuretic calcium intake, or even, for all of us, stress. Stress is a factor of periodontal disease, according at least to this publication. So now I move to the third question. What about the relationship between periodontal disease and diabetes? In other words, is this association by a two-way relationship? I mean, diabetes predisposes to periodontal disease, but periodontal disease predisposes also to diabetes or to pre-diabetes. And again, as I told you, the answer is yes. And I'll show you a few data for that. Also, this is also a difficult slide, but again, one clear message. The risk of diabetes, type 2 diabetes, the risk of incident type 2 diabetes is multiplied by a factor close to 2, is multiplied by a factor close to 2 in people with moderate to severe periodontitis. So if you have periodontitis, if you have chronic periodontitis, you have also an increased risk of developing prediabetes or diabetes. And this was a publication in Diabetes Care a few years ago. At this stage, you could tell me, well, okay, we agree, periodontitis could could predispose to the development of prediabetes. But perhaps more importantly, is there an influence of periodontitis on glycemic control? This is a very practical point of view for every of us. And the answer is clearly yes. The answer is clearly yes. I show you a paper 2013, it's a kind of meta-analysis showing that severe periodontitis was associated during a follow-up of 2 to 5 years, was associated with poor glycemic control in persons with type 2 diabetes. And more importantly, and even more interestingly, is this study showing the influence of a treatment by a periodontologist of periodontal disease, the influence of this treatment of glycemic control. Look, effect of periodontal disease, well, clearly the treatment by our colleague periodontologist is very efficient in terms of what they call the pocket, you remember, the pocket depth, the probing pocket depth. It's very efficient, so 4 millimeter, 42% less pocket depth. It's also very efficient in terms of clinical attachment level. And so we know it's efficient in terms of periodontal disease by itself. What about diabetes? What about diabetes control? Well, diabetes control is also improved. After 3 months, without any change in diabetic treatment, as you can see, glycated hemoglobin levels decreased by 0.36%, only as a consequence of the periodontal disease treatment by itself. So this is also, I think, a very important message for everybody. What explanation for this association between chronic periodontitis and diabetes, or the association between periodontitis and poor glycemic control? It's mainly the insulin resistance. Insulin resistance develops due to a pro-inflammatory state, and this pro-inflammatory state with cytokine production is the consequence of an infection. I told you about microabscesses. Well, these microabscesses, this leads to a pro-inflammatory state and to insulin resistance, and insulin resistance leads to diabetes and to poor glycemic control. So I think the loop is looped. The loop is looped. If we start here, hyperglycemia via several mechanisms, in particular bacterial growth, will favor the development of a periodontal disease. Periodontal disease is an inflammatory state which leads to insulin resistance. Insulin resistance leads to hyperglycemia. Hyperglycemia leads to periodontal disease. The loop is looped. So my last question is my summary. What about the future? What about the perspectives for you and for me? Well, the incidence of diabetes, you know that. The incidence of diabetes is rising worldwide, in every nation in the world. I show you that there was a mounting evidence supporting the relationship between oral health and diabetes. The ultimate goal is for persons with diabetes to have good oral health and access, of course, to oral health services. Most oral disease is preventable. Most oral disease is preventable, and where it does occur, it can be treated. Oral health, and this, I think I share this conclusion with our chairman and with Professor Relic. Oral health should be included in diabetes management guidelines worldwide. Oral health providers will be included in this line. Oral health providers will be included in the diabetes management team, and so persons with diabetes will be aware of the importance of oral health. That is a message important to share. And of course, IDF and other scientific societies will continue, and young leaders, I hope, will continue to promote the importance of oral health in diabetes management. So thank you for your attention.
Thank you very much, Professor. Is there any questions regarding this topic?
Yeah. What about type 1 diabetes, because all the evidence was related to type 2 diabetes?
The question is excellent. No, my answer is not. The answer is not easy, because most papers in the literature concerned patients with type 2 diabetes. No. I show you that. This is a personal study with Dr. Heilich. So these are partial results. As you can see, the aim of the study was to answer your question. Because we assessed oral health behavior, dental status in persons with type 1 and type 2. I think I have the clinical characteristics of type 1 patients. You see, we included 160 patients, and 57 were persons with type 1 diabetes. So this is clearly the answer to your question. We included also non-diabetic controls. And all these persons were asked 6 questions. You can read the 6 questions. But you see what's the number of visits and so. Important question for you, how many of your teeth have been removed or were lost since diabetes was diagnosed? No, moderate, severe. These are the results, and these concern patients with type 1 and type 2 diabetes. As you see, if you consider oral hygiene in general, it's quite the same between persons with diabetes, type 1, type 2, and a control group. But there is one exception. If you look at gingival bleeding, so a sign of gingivitis, let us say, as you can see, this was more frequent. This was statistically more frequent in the group of diabetics versus the control group. But 37% versus 12%. But what you can see, it was similar in persons with type 1 and type 2, quite similar, okay? Now, second question, what about the dental loss? Again, in persons with diabetes globally, in general, 44%. If you look at devastating teeth loss, more than 5. So 44% in diabetics, 18% in diabetics. But what is, and this is the answer to your question, if you look why this is increased in persons with diabetes, you clearly see the figure. The increase is driven by the group 2, by group patients with type 2 diabetes. 54%, and as you can see, group 1, 29%. 29%, this is very close to the control group. So probably type 1 persons with diabetes are concerned, of course, but probably a little bit less in terms of consequences, of long-term consequences, than patients with type 2 diabetes. So this is my personal answer, but in the literature I told you, we have more data concerning type 2 than type 1.
Thank you. Yeah?
How often should we get our teeth checked? Like you come out with a consensus or something. How often should we get our periodontal checkup done?
The periodontal checkup. Yeah. The role of the diabetologist is to inform the person with diabetes that oral health is very important. Probably that an oral health assessment is needed just as an eye fundus or just as microalbuminuria once a year or once every 2 years, according to the patient. Possibly, if there is an oral disease, if there are signs of oral disease, if there is bleeding, this is a question. This is an easy question to ask. Well, if there is a bleeding, probably you have to tell the patient to consult the periodontologist, and he will be the first man for the oral care. But I think the role of the diabetologist before that is to prevent, is to amplify the prevention politic. Okay.
Thank you very much.
Thank you. Thank you.
Professor, thank you very much for this lecture, and we will move on with the topic about general topic of diabetes and oral health. I will try to give you a quick overview about basic knowledge, what you can do with yourself, what you can educate, how you can educate your community at home, and what kind of promotional advocacy opportunities are already being taken. As you know, why is it so important, the oral health for people with diabetes? I will speak about it, and I try to give you some key recommendations. It is basic that if your metabolic levels are normal and you are controlling yourself and you are also going to dentist regularly, you are not supposed to have oral health problems with your own oral health, but of course when the metabolic levels are going in the wrong way, it's also affecting more infections, more problems in your oral health. The poor oral health can basically affect your metabolic levels. So if you have an infection, if you have a caries, if you have, for example, candida infection, your metabolic levels will be harder to control. And also, if your metabolic levels are bad, these oral health problems can occur more often. This is the common in diabetes and oral health problems, and it is also very important when you're going to the dentist. You have to inform the dentist that you have diabetes. It is very important because we are trying, for example in Hungary, we are trying to educate dentists how they can handle diabetes or people with diabetes. Why is it important for the patients to come in the early hours after breakfast, for example? These patients, it's not good if they have to wait so long in the dental office. So if it's possible, you have to reserve a checkup in the early hours, because if you have to wait, you get more stressful, your metabolic levels are going high, so it's inconvenient. And also dentists should prepare for these emergency situations. So basically you can put your sugar on the table and you can tell the dentist that if you go down, you have to eat it. Okay, dentist can stop immediately with the procedure and give you a short time to recover, and then you can have another appointment or you can continue it a little later. Why is it important to go to the dentist regularly? So in the left picture you can see, in the left and the right, this is the same patient. The time difference is probably 20 minutes. In this picture you can see that the teeth has severe calculus, which is a microbiological plaque, and this is not able, you are not able to remove it with your toothbrush or tooth floss. Dentist needs to clean this with some special equipment. It's called scaling, and this procedure helps you to evaluate and remove the plaque from your teeth. And as you can see, here is a little bleeding around the teeth because the gum was in infection. Because this plaque has a space requirement and it makes your gum infected. So this is basically why you have to go to the dentist. There are some areas from your tongue side where you cannot see it from the mirror, but there is also bacteria and plaque in your tooth, and it needs to be removed. If it's removed, not just your oral health, but your general health can be improved. What equipments do you need to use when you want to have a proper oral health? You need to have toothbrush. You need to have toothpaste with fluoride. Fluoride is very important against caries. You can use dental floss after it. Some people are, is there anyone who is using dental floss? Can you hold up your hands? Okay, so is there anyone who haven't heard about dental floss? Dental floss, the wire which you clean the intraproximal area. So between the tooth, here, you can use dental floss to clean it. Is there anyone who never heard about dental floss? Everyone heard about it. Wonderful. So you have to use this too. And also, you can add, for example, a mouthwash after the cleaning, which also helps you to remove bacteria, and also it's with fluoride, so helps to prevent caries. So this is the status we would like to reach with every person with diabetes. This is a picture about a patient who has severe problems in his mouth. As you can see, there are some teeth which needs to be extracted. There are also inflammation, bleeding. This is a failed implant procedure, some periodontal problems in the back. So these are those oral health problems which is more often when you have diabetes and it's uncontrolled or not controlled properly. What are these problems? Periodontal disease was also mentioned in the previous lecture. This is basically when your gum is getting infected and it's bleeding, it's it can be very painful. You can lose your teeth if you have this periodontal disease and it's not treated. It can be also dry mouth syndrome, because when your blood sugar level is high, your saliva production will be lower. So that's why there will be less saliva in your mouth than in a normal person who has normal metabolic levels. Because of this dry mouth, you, of course, and less saliva, the caries can be developed much faster than if you have normal saliva. So caries and tooth decay are more common. There can be a place for oral infections like candidiasis. Of course, there is a delayed wound healing, so if you have some kind of bleeding in your mouth, it will heal much longer. There are also some states in your mouth which is precancerosus, so it's a pre-stage of oral cancer. And for example, in my country, a lot of people are drinking a lot of alcohol and smoking, and alcohol and smoking is rising up the percentage of oral cancer. So Hungary is one of the leaders of oral cancer. So this is also very important. You can have taste problems. You can get neurosensory problems like loss of sensation and also burning mouth syndrome. And from now I will speak a little about advocacy. Earlier this year I was lucky enough to represent IDF with Professor Buysschaert in Madrid, where we work together with periodontologists to create guidelines for not just patients, but for diabetologists and also for dentists, how they should treat patients living with diabetes. As you can see, there were a couple of very high-level experts from all around the world participated in this workshop, and I'm really honored to be there because I was the only one who had diabetes from this group. And I try to influence the conversation in a way. I try to represent people with diabetes, what is important for us. Sometimes a general dentist doesn't really know what happens if a patient is getting problems in the chair. If you get a hypo, in Hungary from 10 dentists, 5 will say you have to inject insulin. And this is not true. So when you go back to your country, you also you have to share with your community. When you go to dentists, you have to educate dentists as well that this is a glucagon kit. The glucagon kit is good. If I'm unconsciousness, you can use it. If I'm not unconsciousness, there is sugar with me. So please stop the procedure when you feel me like dizzy, and I can get some sugar intake. Very, very important, because otherwise you can have some problems during the dental procedures. I also started my oral health interest in 2015 when I started a PhD in Semmelweis University Budapest, and since then we already have 3 international publications in this field of oral health and diabetes. This is also a project which is really important for me because this topic is not really highlighted, not just in the guidelines but also in the educational part. Sometimes when you go to the internal medicine or your diabetologist, the problem is that they are checking your blood glucose, they are checking your eyes. You have to go to ophthalmologist every year. You have to check your blood every 3 months. But none of them are seeing your mouth. None of them are saying, open your mouth, I would like to check your teeth. But if there is bleeding, if there is infection, it will be very easy to refer these people to dentists. And the dentist can help these people. And maybe with this procedure, the patient will get back his confidence. They can fix the teeth, so the patient can eat properly. Sometimes the problem is when you are trying to eat, but you have an infection or extraction, you cannot eat properly. So your nutrition will go to fluid nutrition, and fluid nutrition contains more carbohydrate. More carbohydrate will rise up your blood sugar, so it's a very, very close connection between nutrition, oral health, and metabolic levels. So this is why it's really, really important to have your dental checkups every 6 months, every year. If you have a problem, it's easier to fix it in the beginning. There is also media campaigns in Hungary where we try to participate and educate the general public, also patients and also healthcare professionals. This was a television campaign when we tried to share the importance of the oral health care, and also there were other topics also in the television, and this was also the perioditis workshop earlier in Madrid, where we try to highlight the importance of the oral health. We also had a campaign or educational initiative for Hungarian dentists about diabetes education, because as I said it previously, their knowledge is sometimes not up to date. They have to know about what kind of new insulins are existing, or sometimes they cannot really understand what is the problem with the type 2 patients and the type 1 patients. I mean, if there is an emergency situation, it's different if you are using insulin, and it is different if you are using tablets or metformin, because if you are using insulin, you have a higher risk to have some problems, some hypos during the treatment. And if the dentist is not educated, maybe he will be also afraid, and it can also worsen the situation. So if the dentist knows that if you are feeling sick, you have to drink something, you have to eat something, then the dentist is also not afraid of treating you and helping you. So this is very important. And during this campaign, I was lucky enough to speak in front of dentists in 4 Hungarian cities. In Hungary, we have 5,000 active dentists, and during these 4 lectures, 2,000 dentists can visit live this lecture. So it's 40% of the Hungarian dentists heard about this oral health and diabetes, heard about some special emergency situations, what he can do if someone is unconsciousness, and they found that this is very interesting, and we get a lot of very good feedbacks from them. They are very supportive. And also, we made a campaign for the World Diabetes Day, which means not a red card, but we give blue cards to diabetes with all of the dentists. And this was in one of the events, and all of them are dentists, so they showed blue cards to diabetes. And we are really proud that the Hungarian dentists joined this, and we had the opportunity to speak in front of them. What are the new trends? There are some very interesting topics about oral health and diabetes, and one of the newest is that some researchers are trying to find the opportunity to check the blood glucose level, the HbA1c, during the dental visits. Right now it's in the beginning phase. There are some studies about it, but maybe it can be also interested. But these measures are not so well known around the world, but maybe it can be a diagnostic area, the dental office. Some people, for example, in the United States, the purpose of the study was in the United States, a regular person is meeting with a dentist more often than with a diabetologist or with an internal medicine specialist. So they try to use these dental checkups to check the blood glucose levels, and if they see that it's higher than the normal, then they can refer this patient to the special departments. I think that the message of my lecture is that the most important thing is to make the patient the leader of the dental team. So you are the leader of your dental health. You have to go to dentist, you have to check your oral health with the help of the dentist, and you have to take care about your oral health, and not just your oral health, but you have to educate others in your country who have maybe less knowledge than you. So thank you very much for your attention. If you have any questions about these 2 topics, now you have an opportunity to ask it from Professor Buysschaert or from me.
Yeah, there is a question.
Mentioned that because periodontal diseases would increase the insulin resistance due to the pro-inflammatory cytokines, and will patients with periodontal diseases have a higher prevalence rate regarding to type 2 diabetes?
Yeah.
Like if they have periodontal diseases, they are more likely to develop type 2 diabetes.
Yeah. So it's really a two-way relationship. See, for people with diabetes, they are more at risk for periodontal disease. That's one way, and then you have just the inverse. Persons, non-diabetic persons with chronic periodontal disease, they are more at risk of developing later pre-diabetes or diabetes.
And a second question is that you also mentioned that gingivitis and periodontal diseases are induced by dental plaque,
Yeah.
and which could be removed by brushing your teeth.
Yeah.
And what if you use if you chew chewing gums? Will it also remove it or prevent the development of periodontal diseases with chewing gums?
I think the best way is the brushing of teeth twice in the day. The good way is also to use an interdental wire and then floss. But I think my colleague periodontologists will be more adequate than me for giving more appropriate advices than me for the oral health in general. I think brushing, interdental. Now, if you need some liquid also for hygiene. No smoking.
This is a very good question because a lot of people are interested in, for example, about this question. And also I have a lot of questions in diabetes communities. What happens if my child has a hypo during the night and he has to take some sugar? And after it, what should we do with our children? Should he brush her teeth or what is the solution for it? Because during the night, when you have hypo, you have to drink some sugary drink or eat some sugar, and it's after it, how is the oral health? But regarding to the chewing gum, some dentists are saying that if you eat something, you get the chewing gum, the pH will be like back to normal, so it helps to be less acidic in your mouth. So it is helping you. But the other dentists who are specialized in temporomandibular joint, they are saying that if you are eating too much or you chew too much chewing gum, you will have temporomandibular joint problems. If you know Brad Pitt or some Americans, they have a very big muscles in this jaw area, and this is because of chewing a lot of gums. And this joint is very sensitive. So more than 80% of the people have some kind of problems with their jaw. Maybe it's just a sound, maybe it's a pain, maybe it's not so they have problems, and chewing gum can make it worse, because this joint is not for 24 hours eating, it's for eating like 3 times a day. But if you are doing it constantly during the day, you can have problems here. Maybe it can prevent some caries, but you will have other problems. So there is no consensus between the dentists. And back to the other question for fluids or toothbrush after hypo, it depends. If the children or you are too tired, to go out to the bathroom because you are in a hypo, you are very sleepy, you can use, for example, some fluids, mouthwash, and it is more than nothing. So the best would be to have a toothbrush with toothpaste, using toothbrush with toothpaste, but sometimes you are very tired going out to the bathroom, so then you have alternatives. You have to find your best way, your best solution for yourself. This is our recommendation. If you are using some of these equipments, it's of course it's an advantage for you.
One compromise could be in persons with xerostomia. Chewing gum could be a good solution because the saliva contains the buffer against acid products. And if you have xerostomia, you have less saliva and so less buffer products. So possibly to stimulate the production of saliva in patients with xerostomia, this could be eventually a solution.
Hi, good morning. My question is the periodontal disease connected to glycemic control? Is there evidence that persons with better glycemic control do not come down with the disease?
I can answer. Answer is clearly yes. So there is a relationship with glycemic control. If you have a good glycemic control, you have the risk of developing periodontal disease in type 1 or type 2 patients is clearly decreased. And I will add one recent information to complete my answer. For dental caries is exactly the same. So for dental caries, you don't have more dental caries in the presence of diabetes, except if your glycemic control is chronically bad or poor. See? So this is certainly just as other complications of diabetes. You have to consider it just as a conventional complication of diabetes. The eyes, the heart, the kidneys, this is related to glycemic control. It's the same for periodontal disease.
I want to know what's the relationship with bad oral health to insulin resistance, and if it's the same in type 1 and type 2, and how much is the effect? I mean, it's a little insulin resistance, or is like very important to consider it in insulin dosages and that?
This is a good question, but difficult to answer. If you read the scientific papers, you have the mention. Well, there is insulin resistance, such as in any infection. If you have a flu, you have also a period of insulin resistance. So this is exactly the same, except that it's probably more chronic. And so insulin resistance, even at a low degree, leads to hyperinsulinemia in type 2 diabetes, leads to hyperinsulinemia, and then after that to hyperglycemia. So the insulin resistance is probably more important in persons with type 2 diabetes than in type 1 diabetes. This is probably also the reason why scientific literature brings a lot of information, mostly concerning patients with type 2 diabetes. But in type 1, the indirect consequence of, between brackets, insulin resistance is that if there is a periodontal disease, there is a poor glycemic control, and you have to increase your insulin dose. So for a person for a person with diabetes, even patient with type 1 diabetes, the treatment is excellent. The patient follows exactly what the good way of treatment, and you don't understand why the insulin doses have to be increased, or why the glycated hemoglobin remains high. You have to think, well, is there not a problem of an oral problem?
I would like to answer it too. So when you have periodontal problems, it's affecting your insulin resistance because sometimes you cannot eat properly. So you have to choose a different kind of nutrition than you would eat normally. Which means that, for example, you cannot bite every food. You will bite more fluidly ingredients, and it is a problem because then it's harder to control your metabolic levels, your blood sugar. Maybe you have to inject more insulin, or you have to take double pills to control the same way your blood glucose levels. And I can tell you that it's like same with flu. So maybe the same unit of insulin will be not enough to control that kind of blood sugar. You have to inject more, and if you inject more, you start gaining weighting, and that's why you have to fix your tooth, because sometimes you have pain, sometimes you have bleeding, and you are not able to eat the food. So it's very, very together with the nutrition. It's very in association with the nutrition. So this is why it's very, very important for you, not just to go to dental checkups as well, but also to be the leader of your dental health. So it's a very limited time you are in the dentist, once a year, twice a year. But meanwhile, you have to clean it in the morning, in the evening, and it depends on you which technique and how often you are using it regularly, how often you are cleaning regularly. If you are cleaning regularly, then dentists will have less job, and it's good. It's good for you, it's good for the dentist. So maybe not good for the dentist, but it's good for you.
Hi, is it ill-advised for diabetic patients to undergo like aesthetic or cosmetic oral surgeries?
What do you mean specifically, like aesthetic procedures? Aesthetic or implants or like?
Aesthetic surgery, I don't know. I'm not a specialist in aesthetic surgery. But as far as implants are concerned in patients with diabetes, so patients who lost a great number of teeth, implants are possible. But I know that some dentists are relatively reluctant, and this is very logical because implants are efficient if there is enough bone. If there is no bone, if the bone is destroyed, is damaged by the periodontal disease, implants will be less well attached, you see. And so that's one point. Second point, if you do that, you have to do that really in an excellent glycemic let's say atmosphere to avoid some infections, some local infections. No, other surgery, I don't know what's exactly the purpose.
Usually it's scaling, dental fillings are enough, so that's what we think about with Professor Buysschaert. So the majority of the problems are not because of implants. The majority of the problems are because of tooth loss, bleeding, periodontal problems, and after it, if everything's fine, then we can think about how to, for example, build up new teeth for you. But the majority of the people have some more basic problems. So they don't understand what is going on if a tooth is broken in their mouth, what should they do with it. We see a lot of patients with extremely bad oral situation, just like the picture which I showed you. Sometimes we don't understand how this person can be existing with this kind of oral hygiene, because he has to go on the street, he has to speak with other people. People with diabetes also lose a lot of confidence because of diabetes, and if they also have a bad oral hygiene, maybe these people have or can have some other psychological problems. They are not so open to the community. So this is another aspect which is really valuable to speak about, but not today. So it's a good question anyway, but first the basic dental procedures should be made, and after it you can think about how to build up teeth for the person who is relatively good controlled with diabetes and oral health.
Okay. So thank you for addressing the importance of oral health assessment. It's something that I often forget. But from your experience with periodontal disease, with diabetics, if they have good glycemic control, how long is the duration of treatment? Perhaps there are various stages of the disease, but let's say the earliest stage, how long does it take for them to recover and get back to the usual? And for those with bad glycemic control, how bad the duration it goes, so that we have an idea? Or thank you.
I think this is very variable, because periodontal disease is not limited to persons with diabetes, of course. And so there are a lot of other parameters which can influence the development of periodontal disease. The genetics, some persons have a genetic of developing more easily periodontal disease. Other patients don't develop oral diseases and periodontal disease in particular. So certainly diabetes, or more precisely hyperglycemia in diabetes, is certainly a factor which increases the risk, which amplifies the risk of other conventional factors. Now, the duration is variable according to all these factors, but probably how poorer the control, the glycemic control, how shorter the duration, how longer, not too longer, how shorter will be the time you can develop the periodontal disease. So if your control is bad, is very bad, you will develop more rapidly, more faster your periodontal disease. But the background is the genetic and other factors. If you smoke, it's probably very different than if you don't smoke, because smoking I think, is a main risk factor for periodontal disease. So a person with diabetes who is also a smoker will probably have a duration shorter for developing the disease than a person who don't smoke. So don't have to smoke for that. Other reason for don't smoking.
I'd like to ask if you know if there's a relationship between hypoglycemia and oral health.
No, there is no direct relationship. But I think the answer was the answer of Dr. Vegh. If you have hypoglycemia, you will manage your hypoglycemia by sugars, and so sugars are converted, as you see, in acids, and this is the reason why one of the reasons why periodontal disease or dental caries develop. So indirectly there is some relationship, but not directly. It's not because hypoglycemia you will develop periodontal disease. No, you treat your hypoglycemia, and this could be one of the factors.
Actually, it's not a question. I want to share with you some experience of my country. In my association, we are 3 dentistry students, and actually we believe that we've got the opportunity to help kids about dental care. Why? Because many kids have fear to go to the dentist. Everyone knows it. So if we are leaders and we learn a good health or oral health care, we can teach some kids how, like in confidence, like as friends, not as a patient and a doctor. And actually, we've got a great instance like summer camps. Summer camps, I believe, in every country. In my country, last one week. You've got 1 week to teach a kid about oral health. If you like do the properly health in every food, you are teaching habits to a kid. It's a great opportunity that every leader should start releasing it in your country. Try it. It works, actually. I will talk in experience, it works. So maybe you can learn. Actually, Daniel or me, if you trust in me, better Daniel, ask about proper health and teach it to your kids. It's a great instance, actually.
Thank you very much. I think that we should close this session because we are pretty delay. So we will continue. I would like to thank Professor Buysschaert, and my special gratitude goes to Daniel. Daniel had also great presentation, and also he showed us his perspective as a dentist, but also as a person with diabetes. And he showed us his perspective and also his attitude to, you can see it on this picture, you can approach to any single person, no matter with diabetes or without diabetes. But people with diabetes in their association can do a lot for other people who are not aware of that diabetes is also related to dental health, or dental health is related to diabetes. So thank you very much once again, all of you.
Okay, so just one quick thing before Daniel starts. Do not forget to sign the attendance forms. Once they are all signed, you give it back to me, okay? And now, to Daniel, and you have 50 minutes.
Yep, no, it's gonna be like really quick.
Yeah?
Okay, we're gonna play a little activity to get to know some different people you may have not met yet this week. So everyone should have a piece of paper flipped over, keep it flipped over on their table. Keep it flipped over until I explain the rules. So basically there are some questions on this bingo sheet. And underneath each question, you have to go find someone that meets that description. When the person that wins and can go get their coffee break first is the person that has all of these signed by a different young leader. So you can't have one young leader sign off on 10 of them, and you have to get the entire page, not a row, the entire page.
You have to say bingo when you win.
Yes, and you have to say bingo when you win.
Thank you.